TB stands for tuberculosis, which is an infection of the lungs. I started working with the Hmong community for the last 7 years, and I have seen more people who tested positive for TB. TB is a huge issue worldwide, less common in the US. I think because of the screening that we do and the treatment and access to care that we have for our patients. It is more widespread overseas. Now, MDR-TB is the same bacteria that infects the lungs, but it's become resistant to a few of the medications that we use to treat TB. Now, TB can infect other parts of the body, the brain, the eye, the spine, other organs, but most of the time when people come in, they come in with infection of the lungs. And they usually present with symptoms such as, coughing. Usually it's a cough that's been there for quite a while and it's not getting better. We think about 3 or more weeks of coughing, and usually associated with fever or chills. And often, and not so frequent, but it can be coughing up blood and losing weight if they have TB for quite a while, or losing appetite. So that's when you should be aware that this might be TB. But anyone with a cough that lasts longer than 3 weeks, we should suspect that it might be TB and should check for that. In the US, we found TB mostly in people who are foreign-borns, and not only from Asia, but from Africa, from South America, and other places outside of the United States. TB can be a scary illness for everybody because it is spread, to other people through the air that we breathe. So it transmits easily, within the same space that we share. When someone tests positive for TB, it does not mean that they have active TB. Now, there's a difference between just being positive based on your test and actually having the disease. Now, so when you test positive, now your doctor is going to ask you to do all these other tests. And the reason for that is to determine whether you're active or not. So that's why it's so important that we recognize it and we treat it and we protect people from spreading to other people. And TB, it can be cured, but the treatment takes a long time. And so we want to prevent having to go through the treatment if we can. So we want to stop TB before people become sick with it, before people can spread to their relatives, their families. Recently, with the outbreak of MDR-TB in the Hmong community, we are more vigilant at screening people and asking patients questions when they come in with symptoms that would suggest that TB might be on the top of our diagnosis. People should be aware of the symptoms that we talked about, and if you or a family member have those symptoms, it's very important to seek help, see a doctor or a medical provider, and to get proper evaluation. We can do a lot to help contain this outbreak, and we should be cooperating with our own treatment or treatments of our family members, and we should support each other through this situation. I really encourage people to just complete the treatment when, let's say, if you're diagnosed with TB. So that's a very important point. I want everyone to understand. Help us address this problem in our community. I think it's very important for patients and their families and people in the community who are affected by this disease to help themselves as well as helping their physicians. Our goal is to support the family and to support the community and to keep the community safe.